Hey guys, today we're going to talk about chapter 65, which is the fetal skeleton. Um, and on the side there are my three little chillins with our skeleton Scully that we put out for Halloween each year. So I just decided to include that today because we're talking about skeletons. There's a lot of embryology that is described again in this chapter, and I'd like you to read that and go over that. I'm not going to be discussing it in this lecture, however, but it is good to be familiar with how the skeleton forms in the womb. But what I really want to talk about today is some of the abnormalities that can happen with the skeleton. So when you're scanning a baby and you see something abnormal, I want you to be able to kind of think back to this chapter and be able to kind of maybe remember or kind of identify what might be going on. So the abnormalities of the skeleton, skeletal dysplasia is what we call it, describes abnormal growth and density of the cartilage and bone. So dwarfism occurs secondary to skeletal dysplasia and refers to disproportionately short stature. So I want you to know the term skeletal dysplasia. Some of the skeletal dysplasias are incompatible with life, and we'll look at those today. There are some skeletal dysplasias that most fetus can be viable and actually live to have a as normal as you can, happy life. So we'll go over those today too. So the lethal forms are characteristically extremely severe in prenatal appearance, as with severe micromelia. So the humerus and the femur are so short, um, it's almost difficult to see. There's a lot of things going on with these babies, but one of the main reasons why some of these lethal forms are lethal is because on top of the bones being so short, the chest and the rib cage is also very small. And we know that when there's a very small rib cage, the lungs can't develop correctly and it can cause pulmonary hypoplasia. Non lethal skeletal dysplasias tend to manifest in a milder form. So, what are you going to do when you are assessing for skeletal dysplasia? Let's say your doctor said femur bone less than first percentile, measure all long bones. And we do that a lot. Um, if there is some kind of head circumference, femur length, humerus length, chest circumference that just don't look right or measuring very small for their dates, we'll go ahead and we'll measure all of the long bones, which takes a long time. If you can imagine being on the right or left arm, right or left leg, measuring the femur, the radius and the ulna in both arms, and then measuring the both femurs and the fib in both legs. And making sure that you stay while the baby is moving all around in there, making sure you stay on. So sometimes that can take a little bit of time. We also want to assess the bone contour as we've seen in our lab that we've been scanning. We are able to see very bright white femur bones, and that's good. That means they're calcifying. They're getting their calcium and getting strong and developing into the bone they need to be when they grow up. But sometimes you can get abnormal bowing and fractures and almost like a decrease in echogenicity, so more like hypoechoic, like the bone looks almost see-through. And these are some of the other skeletal dysplasias that can happen too, which we'll go over. So you always want to make sure you're just looking at the bone, making sure it's nice and white, bright. It doesn't look odd to you. So decreased attenuation of bones with decreased shadowing suggests hypomineralization. Special attention should be focused toward assessment of the cranium, spine, ribs, and long bones. So, like I was saying, with calcification, ossification of the bone, as the baby gets older, the bones should uh, develop more and they should shadow more. And the ultrasound waves should not be able to get through them as easy. So with when we scan a baby at 20 weeks, one of the reasons we do that is we can see through the bone still. So we can see really good brain structures, we can see really good abdominal organs, we can see the heart really well because the ribs, the head, the cranium, they haven't quite ossified yet all the way. And so later on, as you guys can start telling as we scan like 35, 36-week gestational moms, it does get more difficult to see a lot. And the reason why this gets difficult to see is because of the increased ossification in the bone, which is what we want to see. Ultrasound wave usually can't go through bone, correct? And so same thing with the baby. So it's important that we are looking for that. If we see a cranium that looks hypoechoic, not echogenic, it's compressible, um, just doesn't look ossified, that could be a sign of a certain type of skeletal dysplasia. So that's just another thing we want to evaluate. We also want to be looking at the thoracic circumference, the shape. Long, narrow chest or shaped chest may be indicative of specific dysplasias. We survey the hands and feet for anomalies such as talipes, which is clubfoot, and polydactyly, which is more than one finger, like more than what we need, like more than 5 on each. You evaluate the face and profile for facial clefts, frontal bossing, micrognanthia, which you guys, I hope you know what that means by now. It means small chin. Don't forget that. Hypertelorism, other facial anomalies that may be associated with skeletal dysplasias. We also survey the other anomalies like such as hydrocephaly, heart defects, and non-immune hydrops. So we're doing that all if a baby comes in for a possible skeletal dysplasia. A lot of the times you're just doing this on your complete scan and you don't even know it. So there's multiple different skeletal dysplasias, and I tried to highlight each one's claim to fame so that because a lot of these skeletal dysplasias kind of present the same way. So you can get confused. But I want you to know specific things about each one. And so I try to highlight what I want you to know. So I hope this helps. The natatophoric dysplasia is the most common lethal skeletal dysplasia. So that's what I want you to know about that. It occurs in 1 to 4,000 to 10,000 births. So it's actually really rare still. And in the Greek word for thanatos is death personified. There's 2 main subdivisions, types 1 and type 2. And this is a postnatal picture of a baby with this. Type 1 is characterized by short, curved femurs and flat vertebral bodies, and type 2 is characterized by straight, short femurs, flat vertebral bodies, and cloverleaf skull. So, cloverleaf skull is one of these indications for a lot of the different skeletal dysplasias, and it's just where I have an image later on in the presentation about what it looks like. Oh, here you go. It's kind of a bumpy, lumpy skull. So sonographic features severe micromelia, especially the proximal bones, which are rhizomelia, so the femur and humerus, cloverleaf deformity with and narrow thorax, which is another thing I want you to see. This is a sagittal view of the chest and belly, and you can see how the chest is so small and the belly is kind of protuberant out here. You can also see a large forehead, like a frontal bossing. And look how short these ribs are. Right arm demonstrates micromelia. That's a humerus, and those are the long bones. Super short, so short. Look how this is the humerus right here, that white dot, or the femur. Oh, that looks like humerus to me, guys. But look at it's just one white bone. It looks like you need to elongate it, right? But when you elongate it, that's what shows up. So if you think you're going crazy when you can't elongate a bone, don't think you might be onto something that it is just really short. Look at these ribs. The chest just can't develop when the ribs are so short. It doesn't give any the lungs enough space. Again, a sagittal image of a very small chest and a protuberant belly. So this is like just a telltale sign of dysplasia. Here's another image. This is the transverse chest with the ribs and then a huge belly. Champagne cork appearance. Okay, so your sonographic findings are going to be protuberant abdomen, frontal bossing, so bulging forehead, and that happens a lot on the skeletal, all the skeletal dysplasias, widely spaced eyes, which is hypertelorism, and flat vertebral bodies. Might have severe poly. I feel like with any of these skeletal dysplasias, there's usually more fluid. Hydrocephalus or non-immune hydrops. Hydrops is where there's a increase of fluid in the baby in at least 2 spots. Next up is achondroplasia, and I really want you to know this one because this is the most common non-lethal skeletal dysplasia. And we have had a couple of achondroplasias in our clinic in the last couple of years. And those babies have come up to visit us after they are born. They results from decreased enchondral bone formation produces short squat bones and most commonly result from spontaneous mutation that can be transmitted in an autosomal fashion. A lot of the times this is very spontaneous. Heterozygous achondroplasia is inherited from one parent, has a good survival rate, normal intelligence, and normal lifespan. Health problems may include neurological complications that may require orthopedic or neurological surgical intervention. Homozygous achondroplasia is inherited from 2 parents. So if both people have the gene, this could be bad. This could be considered lethal, with sonographic findings more severe. There has been a couple. Oh, here we go. Rhizomelia, which is short bones, macrocephaly, large head, trident hands, which is like short proximal and middle phalanges. So they all kind of look at the same. There's not one that's like longer. Deep raised nasal bridge, frontal bossing, and mild ventriculomegaly are the sonographic findings. Here's some famous people with achondroplasia. I used to watch these little people right here. And she's a doctor, and he has a very successful business. And they had a really cool TLC show. I think it was Little People, but she they actually I watched an episode where they were wanting to have their own. They were seeing if they could get pregnant, but they both have that gene. So if they would have decided to get pregnant, um, they could have had that more severe form of achondroplasia that could be lethal. So they decided to adopt 2 little achondroplasia babies, and they just are the cutest little family. They were on TLC. Little People. This is the Little People Big World, I believe. And these 2 parents here, and then look how they had one kiddo that has achondroplasia, but it looks like the other 3 um, don't. And so I think that's really interesting how that genetics works there. Oh, and then if you guys watched Game of Thrones, that little guy on there, he was pretty awesome. So, so if you can remember achondroplasia, that's the one that is non-lethal. These people can have very successful lives. They have sometimes some issues that they have to have surgery for, but overall, it's a better prognosis than some of the other skeletal dysplasias. So chondrogenesis is a rare lethal skeletal dysplasia occurring in 1 in 40,000 fetuses, is caused by cartilage abnormalities that result in abnormal bone formation, hypomineralization. So this is where we get more of the hypoechoic bone. There's two types. You don't need to know that. The prognosis is grim. It's a lethal abnormality with infants either being stillborn or dying shortly after birth due to the pulmonary hypoplasia. Its claim to fame is the decreased or absent ossification of the spine and other bones, but definitely the spine. So also have severe micromelia, macrocephaly, short trunk, micrognathia, polyhydramnios, short thorax, hydrops. So what this is showing here is the skull and how it's more hypoechoic. It doesn't have that ossification, calcification that we want to see in the bones at this time, and also more compressible. That's the femur bone. So it's short, and that's why it's substantially short. It's like shockingly short. It's like, am I measuring the right thing? Am I going crazy short? And that's how a lot of these are. Here's a baby with achondrogenesis. So you have the shortened long bones, really shortened, larger head. See the spine here, how hypoechoic is? It's not our normal echogenic spine that we get to see. Osteogenesis imperfecta is a rare disorder of collagen production leading to brittle bones, manifestations in teeth, skin, ligaments, and blue sclera. There's multiple types. Some of the forms you can't really diagnose in utero. Those will be more diagnosed in when the baby is born. Type 1 and type 4 are transmitted in autosomal dominant fashion, while type 3 is severe form. Type 2 is considered the most severe form, which is the lethal outcome. It's 1 in 100,000, so it's pretty rare, really rare. Here's a postmortem picture of a baby with type 2 osteogenesis imperfecta. So type 2 is the worst. I want you to know that one. And that's lethal. Children with type 1 and 4 may be short and have multiple fractures during childhood. If you guys have ever heard stories of kids that are easily fracture their bones, and they might have osteogenesis imperfecta. It has presented with an increased nuchal translucency in the first trimester pregnancy. So we want a nuchal translucency of less than 3 millimeters. So when you're measuring in the first trimester from 11 weeks, 6 days to 13 weeks, 6 days, or yeah, you want to see that nuchal translucency less than 3. If it was increased, that could be an osteogenesis imperfect actually presents like that. So that would be something on your mind potentially if nothing else was looking bad. So specific sonographic features of osteogenesis imperfecta type 2 is generalized hypomineralization of the bones. So you're going to just see hypoechoic bones, multiple fractures of the long bones, ribs, and spine. Now, I have never seen a fracture on a long bone before, but I've seen images, but never seen a fracture, probably because this is such a rare disorder. narrowthorax, or micromelia. So here's the chest, here's a hypoechoic brain or skull. You can see the brain really well because it's so hypoechoic that ultrasound waves can just like fly through. So what I wanted to show you here is the femur bone. You can see there's fractures in the bones, which is it's just so sad. In addition to findings, brain structure clearly visualized because of hypomineralization of the calvarium. It'll be compressible, so you can kind of push down just like you can on the baby's abdomen, and multiple fractures have occurred during pregnancy, and polyhydramnios may be evident. I don't know why this one gets to me. I think because my daughter fractured her wrist this summer, and she was in so much pain, so it just kind of makes me like so sad for these babies that are in here that have fractures already. They're like not even out of the womb, and they're always already having to deal with that. It's awful. Good thing it's so rare. It's like 1 in 100,000. Here's a little guy that has he was in The Middle. I love that little sitcom. And I think he like has played in a couple different things, but he has osteogenesis imperfecta. He is a mild form, but he is a shorter guy. Okay, congenital hypophosphatasia, a condition that presents with diffuse hypomineralization of bone caused by an alkaline phosphatase deficiency. Hence the name. So that's going to be easy for you to remember if you have a question on your test about it. This hypophosphatasia and phosphatasia, that'll hint you off. Again, really rare, 1 in 100,000 births. May have features similar to osteogenesis imperfecta or chondrogenesis. Diagnosis confirmed with alkaline phosphatase assay achieved through fetal blood sampling, chorionic villus sampling, and DNA analysis. It's a lethal disorder because of respiratory complications. Have you guys started to figure out that those lungs are pretty important and need to develop for this baby to live? In our kidney chapter 2, it was all about pulmonary hypoplasia, and the same thing here, pulmonary hypoplasia. That's what makes this lethal. So diffuse hypomineralization of bones, moderate to severe micromelia, extremities that may be bowed, fractured, or absent, poorly ossified cranium with well-visualized brain structures, and small thoracic cavity. Dystrophic dysplasia, another interesting one that has a lot of the same characteristics as the other ones. Its claim to fame, though, is hitchhiker's thumb. So the thumb is adducted there. So fixed abducted thumb, hitchhiker thumb. That's going to be your claim to fame with the dystrophic dysplasia. Micromelia, talipes, scoliosis, clubfoot. I said it again. Micrognanthia, small chin, cleft palate. Look at that thumb. Captomelic dysplasia is known as bent bone. So I put that in your notes. Bent bone is what you want to distinguish when you think of this one. And let me show you why. It's lethal. Oh, because of pulmonary hypoplasia, just like everything else. When in doubt, put pulmonary hypoplasia. The bowing of the long bones with lower extremities affected most severely. So bowing of the long bones, and then everything else that we usually see on all the other skeletal dysplasias too. So this is a femur bone and that is bowed. The links were normal, but it was bowed. So if you see like rainbow bones, Bowing, that would potentially be a reason to um, think that it could be this. It would be worth mentioning in your report for sure. Here's the bowing of on an X-ray. Again, this is very, very rare. So I've never seen the bowing of the bones, but I do look for it because it's always on my mind. Abnormal plantar flexion. So there's clubfoot. This is another postmortem picture. See the toes are bowed, arches are bowed, just bowed. Short rib polydactyly syndrome is characterized by short ribs and short limbs and polydactyly, which is more digits than needed or normal. But that's what I want you to know about that one. That should be pretty easy for you. Multiple types, you don't need to know that. But it's a lethal anomaly because there's short ribs. And with short ribs, what can happen? The lungs can't develop, which results in pulmonary hypoplasia. You guys, I had to, I was helping with a student today and I was like, let's try to get a picture that'll really like get to them. So we found this image of a polydactyly and not just one, but 8 toes on each side. So this is one of the symptoms. Granted, this actually feet look pretty big, so this person is probably didn't have short rib because that's more lethal. But this is what, yeah, that's a lot of toes. This is what we usually see: 1, 2, 3, 4, 5 in a thumb. So 6 digits. I mean, I've seen that before, but I haven't ever seen that before. There's other sonographic findings of the central nervous system, cardiovascular system, genitourinary tract, and polyhydramnios may be identified. June syndrome is known as asphyxiating thoracic dysplasia. It's a skeletal dysplasia characterized by a very narrow thorax. I wonder if these babies survive. Probably not. The most severe form results in death because of pulmonary hypoplasia. So small thorax, rhizomelia, renal dysplasia, and polydactyly. I've always liked Ellis Van Creveld syndrome because it just reminds me of an Amish name. And this is more, well, because it is an Amish name, because it is more frequent in the Amish community. So that's what its claim to fame is. And it may present with a narrow thorax causing pulmonary hypoplasia, heart defects. The most common is a atrial septal defect, and approximately 1/2 of people die during infancy from cardiorespiratory complications due to narrow thorax. You'll get it. I know it. If you haven't already got it, you're like, Lindsay, please stop saying that. Other features include abnormal teeth, hypoplastic nails, and thin hair. But survivors have normal intellect and short stature. So limb shortening, narrow thorax, polydactyly, heart defects are sonographic findings. Caudal regression syndrome is super interesting too. I watched way back when in 2020 on a baby that had cyanomelia. Little did I know back when I was a young 20-year-old that I would be teaching it someday, or actually I've seen it before, like once. And I've seen like a basic caudal regression syndrome where the sacral spine has just decided not to develop, which is really kind of strange. So it includes a range of malformations of the caudal end of the neural tube, cyanomelia, and it's an anomaly in which there is a fusion of lower extremities. Here's a couple images. It's like mermaid. So that 2020 thing that I watched way back when, if I can remember, they were um, planning on doing surgery to separate the limbs because there's other things going on. I was kind of like, bladder, genitalia, like what's going to happen with that. And I haven't researched it too much, but I do want you to know when you see fused lower limbs, this is potentially what's going on. And this is what you would see. Both limbs are fused there. This is very rare, very rare. So you would also have a single umbilical artery that's associated with this, which is like the least of your problems when it comes to this. It's associated with monozygotic twinning and cocaine use. So other sonographic findings are sacral agenesis, talipes, abnormal lumbar vertebrae, pelvic abnormalities, contractures, or decreased movement of lower extremities. So sacral agenesis was noted here, and that was one of the caudal regression ones that I saw, was just it terminated at the lumbar spine, but you didn't see the sacral spine. It's very odd. Cyanomelia is a variable fusion of the lower extremities, so make sure that those legs are separated when you look. Bilateral renal agenesis, oligohydramnios, and single umbilical artery. Here's another baby with the fused lower limbs, cyanomelia. Factorial, we've talked about this a little bit, but it always comes back up because it's a group of associations with different things. So vertebral defect, anal atresia, cardiac anomalies, tracheoesophageal fistula, renal anomalies, limb dysplasia. So of course we had to include it because these are limb dysplasias. So for Vactoral, 3 features must be identified. A single umbilical artery may be identified. I've never had them like say this before, that it could be potentially this, but I guess it's really good to know. I have seen a baby with like vertebral defects and limb dysplasia. So I'm assuming that I probably have seen this before, but they haven't ever called it this that I remember aware of. Postural anomalies, normal development of the fetus requires movement. Multiple events can cause decrease in fetal movement, oligohydramnios, multiple gestations, congenital urine anomalies. Decreased movement may be due to abnormality of fetal nerves, connective tissues, or musculature. You definitely want to see those limbs moving, guys, because there's another thing we're going to talk about called, okay, I don't want to screw this up, but arthrogryposis multiplex congenita. And I've seen this before. I didn't catch it until like 29 weeks, but those arms were splayed back and the feet were clubbed and not moving, and the limbs just basically did not move the entire time. And it was like a 29-week fetus that should have been moving its arms, legs. We've been scanning them. We know that what they do. So the condition is marked by severe contractures of the extremities because of abnormal innervation and disorders of muscles and connective tissue. And it represents a group of disorders that may be inherited or sporadic. So sonographic findings are going to be like rigid extremities, flexed arms, hyperextension of knees, clenched hands, talpies. And this baby had all of that. And then I was like, this is not look good. Not look good. So you just see them all clenched up in there and just never moving. Now you're going to scan some babies at 20 weeks that are curled up like this in a ball, especially if it's the mom's first pregnancy. And they might stay like that for a little bit. But if you get the moving, have the mom go to the restroom, come back, most of the time the babies get out of the ball. But if you see a baby that is just for real curled up like this the entire time with no movement of the limbs, this might be something that you need to put in the back of your mind. Polyhydramnios or oligohydramnios may accompany this condition, as can anomalies of central nervous system. Pina-Shakir syndrome is characterized by abnormal joint contractures, facial abnormalities, polyhydramnios, IUGR, and pulmonary hypoplasia. This syndrome has the same characteristics of trisomy 18, which we'll be going over pretty soon. Contracture, clenched hands, talipes, rocker, bottom feet are the claim to fame on this one. So sometimes you can just have a hand or foot that is just missing. That's why it's so important that we're always evaluating in our complete scan that upper arms and lower arms with the hands and upper legs, lower legs with the feet for multiple reasons, because there could just be a hand or foot missing. I've seen this a couple times too, which is just very odd that just one hand is missing. Could be associated with amniotic band syndrome. So here is a 20-week fetus with symmetric absence of hands and feet, unknown etiology. And I've seen just one hand missing before. Here is clenched hands. That occurs in trisomy 18 and the Pina-Shakir syndrome. What you're going to see, I want you to be able to kind of look at and identify the most is clubfoot, because that's going to be, you guys have all heard about club feet. It's one of the most common abnormalities that you're going to see. Usually I was kind of nervous when I started because I was like, gosh, am I going to be able to pick it out? But it usually just like is so obvious just because the sole of the foot is always facing almost to you. It's hard for you to get a profile of the foot because of how the club is. There's a male predominance to this. But see, you try to get like a lower leg and then the sole of foot is always showing up. Here's another image. Sole of foot with the bone, and with these two bones looking straight at, you should just see a straight foot here, or a straight, foot. But you're seeing a twisted sole. Rocker bottom feet are characterized by prominent heel and convex sole. So like the feet are like convexed, I guess. It's associated with multiple syndromes, especially trisomy 18. I see it sometimes with club feet. So here's some more pictures of club. So you definitely want to be able to identify that, because I've seen that a lot. Of a lot of the anomalies, I think club feet is probably one of the ones that I see the most. All right, that's it for today, guys. Have a good day.